Hello, I'm Helen Milner from Good Things Foundation and welcome to this episode of Digital Futures for Good. Today we're going to be exploring the link between improving health outcomes and fixing the digital divide. Digital Futures for Good is a 2024 conversation series where we're talking to thought leaders from policy, from businesses, from charities to see what kind of society we want if we really can fix that digital divide. Today I'm joined by Dr. Minal Bakai, who's a GP and is also the Director of Primary Care and Community for Transformation and Improvement at NHS England, and Professor Sam Shah, who has wide experience in digital technology, in health technology, public health and law. So I'm sure we're going to have a really great conversation. Welcome, both of you. I'm going to call you Minal and Sam now. We're going to look at some of, our hopes and fears for society for the future, obviously bringing health and digital inclusion in together, but also focusing on some of the benefits and the challenges that we have with the current digitisation of public health and people accessing that. So let's start at the top with our optimism. So what are the benefits, do you see, for using technology to improve health outcomes? Madame?
Well, I think digital technology is an incredibly powerful enabler of health and healthcare access. And I think health is one of our most precious, it is our most precious asset. And it plays an absolutely critical role both in our personal well-being, in economic growth, in our social connectedness, and in community development. And for me, I think we have this really important opportunity, particularly in primary care, because primary care is the front door to the NHS. So 93% of contacts with the NHS are with primary care. Primary care is deeply rooted in its communities. We have a really good understanding of our communities and really strong relationships. Almost everybody is registered with a general practice. So our reach is really incredible. And primary care, I would say, is one of the most innovative parts of the health system. So the combination of all of those elements means that if we can embed better digital access, digital enablers to improve health outcomes, and really focus on digital inclusion as part of healthcare, then I think the scale of the impact could be really incredible.
Fantastic. I'm sure we'll pick on some of that later. Sam?
I think that's fantastic. And clearly there's a massive role for primary care. That's where the interface takes place. I think I'm going to take it upstream slightly more. I'm going to give you the public health dimension to this. I think digital places create fairer lives. So fairer digital places for fairer lives is where I sort of go with that. And the way I think of this is that we've got everything from digital itself as a way of tackling wider social determinants. So it makes people's lives healthier automatically through tackling some of those things. At the sort of strategic level, the data about individuals helps with better planning decisions and local authorities and health working together to work out where people's needs are. What do we tackle? What do we focus on? Where do we target these things? At the level of organizations and structures, really thinking about what is it that people might need in order to maybe access services, but the awareness of what might be wrong with them, what they can do to improve the way they live their lives, and not just the health component, but the other things that impact on health, whether it's access to education or any of those things. And then there's really the thing that's probably important to all of us, that piece where digitalization, digital itself, could help people improve their outcomes in their lives, focusing on how they optimize their health, how they do the best they can, whether it happens to be around everything from all the way down to taking medication to all the way to the other side, knowing how to manage certain conditions. So I think there's probably space in all of those things, but really the biggest piece is the early awareness and information about healthcare and reducing the information asymmetry that exists for the population.
So we know already that probably within our society there'll be people who are already doing some of the things that you're saying. And, we can look to the future, and I'm sure new tech and emerging tech will help us improve what you've already described and more. But also during this series, people have already talked about a two-tier public health service now. or two-tier public services, not just health, obviously. And one of the things that we hear a lot from people within the Digital Inclusion Network is that people can't get GP appointments, as an example. So how do we square that circle? How do we make sure that we reap the benefits of digitisation, but we don't leave people behind? How do we make that happen?
So for me, I think it's about having a more inclusive model overall, and a key part of that, a key enabler of that is digital and digital access, but it's not the whole thing, it's the model. So we mustn't look at digital in isolation of the rest of the system and how we work our processes. So for example, you mentioned general practice, I'm a GP, I work in a really deprived area in northwest London. Most of my patients are working 0-hour contracts, low-income jobs, have significant caring responsibilities. And they have been, so where I work, there's a 10-year difference in mortality for my communities compared to some of the more affluent communities. Our prevalence of diabetes, cardiovascular disease, mental health, cancers, but particularly those cancers with the poorest outcomes, are much higher. So we need to make healthcare access really easy, and we need to improve the experience of access, because we know from all of the patient surveys, typically the population that have the poorest experience are also our most deprived populations. And so nationally, we are looking at a model of modern general practice. So it means that we move away from a first come, first served approach, fastest finger first, and a single one-size-fits-all model, to one where you have more inclusive access. So you can access through going online, the telephone, in person. And what we see is that people use access routes dynamically. It's not that they're always online or they're always on the telephone. It change depending on their circumstance, the urgency of their need. So choice is really, really important, but it's also about parity of access routes. So each of those contact channels is treated equally, and that they're all highly usable and highly accessible. But in addition to that, and this is where the model comes in, it's also about understanding needs better at the point of contact, because then we can understand what's being asked of the service, and rather than first come, first serve, prioritise care based on needs. So it's fairer, it's safer, it's also more efficient, because we can then get people to the right professional, the right service, the right team first time, but also respond to their needs more flexibly. So again, there isn't a single size fits all, being able to respond through the telephone, in person, messaging, and that starts to produce a more inclusive model of access and care delivery. And what we see in the evidence, because I think it's really important that we are evidence-driven, we really understand the implications of the changes that we're making. What we see in the evidence is where you have well-designed technology that is well implemented and supported well, patient experience is higher, staff experience is higher, continuity of care is better. We know continuity of care is directly linked with better health outcomes, that people are being prioritised based on their need, and the service as a whole is more responsive, but we're not leaving people behind. It's not just those that are digitally enabled that are benefiting, everybody is benefiting, and I think that's the crux of the change that we're trying to make.
I worry with that a little bit, because I think you're quite right in terms of it's really important we don't leave anyone behind. And I really like your approach to service design as sort of being a way of tackling this. But I worry about the reality here, in that service design as a concept is absolutely amazing. And of course, in every aspect of digital transformation, we think about service design, the needs of users, the experiences. Then there's the reality. There's the reality of what we've seen over the last 5, 10, 15 years of transformation programs led by governments and health systems, where they start off with the best of intentions, there are then cuts to those programs, and then what ends up happening is the things we start off with for all citizens then doesn't become for all citizens. And let's take the whole digital issue, and particularly the digital divide. We've got those people that live in digital poverty. For them, they can't afford access to the internet, devices, modern technology. Their lives are such that they may not be able to get online at the time of things. Then we've got big healthcare organisations and health service departments that are planning for technology and digitalisation, but not, say, recognising those people that we otherwise left behind. And I see this with hospitals sending letters to patients about digital appointments without recognising the needs that the GP's already picked up, that person has particular language needs or has other particular technology requirements that are not then conveyed by the hospital on the other side. That's no fault of the GPs, it's not a fault of the hospital clinicians, but it's a system, a service design issue. And those things I worry about, that they get forgotten in this. And so I love the aspect and the sort of concept of service design and trying to bring that into our work and that, using that as a way of solving this. But I worry that we've got deeper and deeper inequalities in digitization that are emerging. That divide may on the surface be narrowing, but we've got a group of people that are disproportionately affected by the lack of access. So even though we might design amazing digital services, complement them by existing physical services, the gap that emerges both for them and clinicians seems to be deepening, and those are the people I worry about because they probably have the greatest healthcare needs, but our systems and services don't really seem to be designed around them and for them. And really, I want everyone in the health system, whether they're policymakers, clinicians, or otherwise, asking the question, where are the others? Because those others are the people who have those needs that we sometimes forget. And as our workforce moves towards virtual wards or remote monitoring, they might not be in those physical places where those people are presenting anymore. So I worry about that divide that gets created.
And I think the thing I would add to that, Sam,
Go on.
sorry, I think the thing that I would add to that, Sam, because I think you're right about the challenge, that this can't be solved by any one organisation. It needs a whole system response. It needs everybody to lean into this. And so just as an example, I was in Lancaster the other day looking at the brilliant work that they've been doing around population health, because, you know, this is all part of a population health approach. And I visited an estate, a community, and this was a community that had, although they were registered with general practice, they had not engaged with general practice. Most of those individuals had not engaged for at least 5 years. And I think what we're describing is moving away from a reactive approach to a proactive approach. And it's about creating the step change, the headspace, the capacity to be able to really embed that more proactive approach into some of those communities. But what's also really important is that digital is one social determinant of health. And, you know, the challenges that community was facing was challenges with digital access and inclusion, but also with education, with housing, with employment. And so we need to look at it as a whole, and we need that partnership working across all, you know, across the whole system. And I think we do have an opportunity with integrated care systems that starts to build the pathway to enable us to do that. And if I go back for a second to primary care, you know, primary care has been working very closely with the voluntary sector, the community sector, local authority for a really long time, because we're all deeply connected to those communities. But I think the challenges there are that it takes a lot of time. You need that distributive shared leadership. You need those brilliant connectors to build the relationships both between the partners and understanding how we all work, but also with those communities. We need to be creative about how we use our funding and resources, because there's probably not going to be a significant injection of new money, but what we start to see is shared business cases, pooling of resources, because there's a long-term strategy, as you described, and shared outcomes towards where we're headed. But I think also really importantly, there's shared learning, there's shared data, there's shared knowledge, all of which can start to galvanise some of those changes. And I know with the Good Things Foundation, and I've particularly worked closely with some of the digital health hubs, it's a really great example of that partnership working, of bringing health and digital close together, because they're inextricably linked.
Yeah, that's right. I think part of the problem, I think, Sam, is about how do you make that system change happen. Obviously, you need leadership at all different levels. I think sometimes with digitisation that we found that there's the ideology is understood we leave no one behind, we must leave no one behind. But actually the people who are then involved in the service design, in the digitisation, have never met anybody who's digitally excluded, right? They've never met people with complex lives, let alone complex health conditions, let alone also being digitally excluded. Because we really do have that divide, that have and the have-nots. So making sure that we do take the people who are the leaders but also the doers in that digitisation of something so important like the health service into communities and ensuring that they understand that complication. And that I think a decade ago there was lots of people talking about, the Uberization of public services. I think there's an understanding now that something like the health service is more complicated than ordering a pizza or ordering a taxi. But there's still a misunderstanding and a misalignment, I believe, that the digitisation train is going much faster than the kind of things that you're talking about proactive, strategic, and even just understanding people in communities today.
And this whole piece about community, sometimes I worry that the biggest, the most senior decision makers and the leaders may not necessarily understand communities. Only this morning I was reading a report about how people's shopping habits, especially in certain communities, has changed. They've gone back to physical face-to-face shopping as opposed to online. And that's maybe not about their digital literacy or even about digital poverty, but just about them people seeing each other and wanting to go to a physical place. And it kind of takes us back to the concept of how a hub could be useful, because what people may have thought of as the hub might be more than just a place where they gain some more skills or learn how to access service, but it's bring people together. Any other public health program, we go into communities, we try and empower communities to take ownership of something and give them a degree of control to solve a problem. Well, should this be any different? Should it really be the likes of integrated care systems doing this? Or should we be handing it over to communities? Because if I had any degree of confidence, it's probably not in integrated care systems in the NHS or otherwise. Who knows how many days they'll last for, because the rate and pace of change in health systems will probably be far greater than the changes in communities. So even though digitization is moving at a rate of knots, communities, especially those most affected, might not be.
So how do we make sure, though, that the investment and innovation happens in the right communities? So we know that there's a huge health inequality across the UK. We know that a woman who is 60 in a poor community experiences the poor health outcomes that a woman of 75 in a richer community. So how do we make sure that this isn't just this kind of horrible level playing field? Because we know that health inequalities really affect some communities more than others.
And I think that for me, this goes back to that shared knowledge, learning, data. So those that work closest to the communities need to be empowered to be able to work in this way. So I agree, Sam. The element of localization is absolutely key, and that transcends then any restructure or organisational change. And actually, if you ask communities what matters most to them, they want services to meet their basic needs, but they also want opportunities and they also want to contribute. They don't want to be passive recipients. And so through understanding where those vulnerabilities are, going back to health, poorest health outcomes, and taking that population health management approach, being able to connect into those communities. And I think we've just got to be mindful that actually it takes time to build those relationships. And we need to value relationship building as a really important activity. Typically, we value appointments with healthcare professionals, but actually we really need to also value that the real importance of relationship building, because that's part of the key to the sustainability of some of this work too.
Yeah.
And then work with them to understand what matters most to them, and then invest funding and resource, but to meet their needs.
Yeah.
And almost we are accountable to the communities for then delivering on some of that.
Yeah.
And that helps us also bring together, I think, some really important shared outcomes, because this is multi-agency, and some of the challenges that the outcomes that often we've been asked to work to don't always align, and they certainly may not align to what matters to our communities. So if that can bring us all together, then that I think is a really important hook of which to hang strategy, resourcing, funding decisions and hold us all to account.
So we know that these communities that will be experiencing high levels of health inequality will also have high levels of digital exclusion. Do you think there's an opportunity there? So if we act on digital inclusion, would that reduce health inequalities, do you think?
I think so. And I think of digital exclusivity or inclusivity or even the divide as being one and part of the paradigm of health determinants. So if we were to, for example, do something for the entire population, just have a basic level of online access available for the entire of the population. That is one thing we could do across the country that probably make a difference to absolutely everyone. And it's the sort of thing that could be done fairly. Offer it to everyone, but the people that will benefit the most are the people that have the least access and are probably the most deprived. The second thing is set a standard on the type of online access that we set with society as an expectation. The next level after that is almost around working out which are the most deprived communities that have the lowest access to education and employment, have the worst health outcomes, and almost disproportionately focus on those groups. Because by doing that, we'll improve their health outcomes, we'll probably have an economic benefit, and in the long term, we'll probably improve the overall sort of outcomes for society. So how about taking those areas and almost disproportionately focusing on the worst 20 areas? And I remember during COVID, there's an example, I was talking to colleagues in Wales, where they were like, they couldn't understand why telehealth access in that particular place was so low. I said, well, have you actually looked at online access there? They pretty much are disconnected from the world. So are you really that surprised they have no telehealth access in that place when they can't even get the internet in that place? And so it's fixing those basic things that might even change health outcomes.
I think just building on that, what you're highlighting is that digital exclusion can be multifactorial. There isn't a single reason why everyone is digitally excluded. It could be because the infrastructure is really poor, rural, coastal communities, broadband, mobile data. It could be because people don't have access to devices or can't afford the data. It could be because actually the design of the technology is not very usable, it's not very accessible. But it could also be, skills, trust, motivation, what happens next, what's happening to my data. And so it needs a complex response to such a complex challenge. But what I would say is that I think there are some really green shoots. So, there are lots of challenges, but I really think there are some opportunities. But the opportunities are quite basic things that we can change, that can make a really tangibly huge difference to the people that use our services. And I'll take an example of practice websites. So I'm pretty sure everybody has accessed their practice website. And I'm not going to ask you what you think of them. You can save that for later. But, I think we all know historically they've not necessarily been the most usable or accessible front door. But actually they're a really important front door. So 62% of the population tell us that they use the practice website to navigate to other health services or navigate general practice services. And so if we just start there, we did some work, some really extensive user research with those that are least digitally confident. So that 30% of the population that is least digitally confident, going back to the point that we need to design for those that are most disadvantaged. And we asked them what was most important to them, and actually there were 7 things that they were coming to the practice website to do. So that was where we focused the improvement. So 80% of the need was around 7 key digital journeys. So it starts to make it feel less kind of unwieldy. And then we worked with them to improve those journeys. And there were 4 key things that we needed to do to improve those journeys. We needed to improve the language and the written content, the reading age, so it met people's needs, avoid using jargon, and reduce the volume of text. So people were not having to read, paragraphs and paragraphs. They were getting to the information they needed really easily. It's the structure of the information. So being able to find the starting point really easily. Clear calls to action, sort of headline structure. And then it was about accessibility. So not using unnecessary or images where they were unnecessary, because that's an accessibility barrier, making sure that we alt text images, avoid clickable images, avoid PDFs, things that actually are really straightforward but we don't always think about. And then communicating, letting people know what happens next, what to expect. And the outcome of that, and it's still a work in progress, is that we have improved over 2,000 practice websites. But it's partnership approach. We've worked with the suppliers to improve their templates. We've produced guidance for people buying the websites to make it easier to buy good quality websites. We've created copy, so you can copy and paste usable content. So you don't have to sit there as a practice manager who's got 1,000,001 tasks to try and design that yourself. But really important, we've identified the skills you need, because I think we sometimes take for granted that these skills exist. And in my practice, as a reflection, my staff are from our local community. They're going to face the same challenges as some of our communities do. And so we may need to then think about what's feasible at what level. How do we bring those skills in? Do we buy them? Do they come from the system? Do they come at scale? Or do we have them? Because it's not just about creating usable journeys, but it's also about maintaining them.
And I think, people, citizens, use services every day, right? People, where they can use digital services, they'll be going online to do everything from buying train tickets to shopping online, where it's possible to do so, essentially banking online. But for commercial organisations, they've realised that by creating a great user experience, users will have a better journey and complete their online journey and their transaction. The health system, the relationship is different. There isn't necessarily that same type of incentive. So what are some of the other incentives that users effectively generate around their experience that practices have to sort of deploy? Because what we've done at the moment is taken the offline journey and effectively attempted to pseudo-digitize it. Go into any classic health service organization, go into a pharmacy, a GP practice, albeit a dental practice, see posters everywhere for do this, do that, and do the other. You're bombarded with information. And the websites almost became a reflection of being bombarded with lots and lots of downloads and click here and click there. We didn't simplify the journey around a digital experience. So as you say, some of that may not be down to the individual's accessibility to a device or even paying for access. It's how usable we've made these things. And I think there's something there about allowing users to be more vocal about what they want that would help them have a better experience.
So coming back to the people though, because I think you just winded it out. So there's 8.5 million adults who can't do the very basics. So they can't shop online or see when the next bus is coming. There's 2.5 million households who can't afford the internet. So if we focus on those groups, because I think the ones who can get to the website, can afford that access, but can't read it, then we're not talking about 8.5 million, we're talking about 25 million, right? So it shows the scale of the issue we've got with the online, high digitally engaged community, people like ourselves, designing those services, designing the system, in fact, for the people like us rather than those other people. Coming back to the idea of investing in those very most deprived communities, high health inequalities, low digital engagement, poor housing, probably in and out of food banks, 0-hour contracts, that we actually already have a bit of an ecosystem already. So as you know, Good Things Foundation, we support the National Digital Inclusion Network, over 5,000 hubs, digital inclusion hubs across the country. There's family hubs growing, hopefully taking some of the best practice from Sure Start. There's banking hubs even in some of those places where banks have all closed down. So we have an ecosystem, and we have primary healthcare as well. Actually, recently in Birmingham, one of our digital inclusion hubs ran a pop-up data bank. So part of our service is people can get free mobile connectivity. We have in Virgin Media O2. You can get O2 SIMs through those data hubs, and that the GP practice said they would have a pop-up in their surgery. They sent a text out to their patient database, and the line was down the road and round the corner. In fact, the need was so huge in that community that when the practice closed at 5 p.m, they still had a massive queue. Obviously, that digital inclusion hub managed to tell them how to get the SIMs another day. but the need just of that very basic affording the internet, that GP had no idea that they had that problem with their patients. But therefore that ecosystem isn't working. We're not knitting it together well enough, are we? So what do you think we could do to really, I guess it's partly to do with when you're improving health outcomes, when you're curing people, I guess maybe let's take it to the, to what the NHS mostly does, then you're probably not thinking about whether or not they can afford the internet, but clearly that's going to have such a massive impact on their health outcomes. So how can we make that work better?
I think the first thing is probably to also take it just out of the mindset of just the NHS.
Yeah.
In that our focus around health often is around the NHS as one system. The NHS as, I guess, one part of an ecosystem, whether that's the non-health determinants or other parts of healthcare that might be provided in different ways. So that's kind of one part of it. The second part, though, is also translating the way policymakers think about planning for health. So even down to a needs assessment. Historically, we'd look at where people access services and which services they already access. Who has ever really looked at the digital needs of the population and worked out how many of them need access to data and make that part of a needs assessment? That might help us focus and target where we might want to either put health services or things that will support health services. That's kind of one other part of it. The other thing is changing our mindset, our lens. We think of things in health from quite often, perhaps from a healthcare lens. What about all the other assets in a community? The hubs, the schools, the nurseries, the supermarkets, the marketplaces that people get together. Shouldn't that become part of our wider set of health assets that we engage with? And so we just need to change mindset and culture. And if I was approaching it, be thinking about how to change those of strategic policymakers, politicians, counsellors, and people who are responsible for those big decisions around healthcare. Those people at a community level who have the direct access and who can engage, and then moving the resource, rather than putting all the resource in so downstream that it can't really have that impact, taking a bit upstream and thinking about those hubs as being the receiving point where we can make a difference, and joining up with the likes of whether it's Virgin O2 or others around implementing some of these types of schemes.
Yeah, absolutely. I think that investment point's critical. So let's think about investment. Let's think about the future government, right? So I think we know what to do, right? We've got it sorted. So what would you like a future government to do? So obviously not the current one, a future one.
So I think for me, I would put health at the centre of all my policy, and the creation of health at the centre of policy. And this is multi-agency, as we've talked about, multi-sector, cross-government. And so we already have some really great work that's already happened. You've described loads of it, Helen. We've got an architecture, but I think for me it's about how do we accelerate some of that. So we've got, the data banks, the digital banks, we've got the skills, training, Learn My Way, that I know that you've championed so wonderfully. During the pandemic, we had our telecom and mobile phone companies with their sort of zero data policy. So if you were accessing, NHS services, you could do that without cost. Well, why can't we extend that to all public health services that are all critical for basic needs management? But what I would do is I would ask across every government department that health is a kind of key outcome and priority across all of their work. All policy initiatives need to demonstrate how they're improving health. And I think it's really important to bring the community voice back into this. So for me, I kind of look at this a bit like climate change. And we've got net zero, really ambitious, multi-year, long-term policy objective. And so could we do something similar around health, where we understand what is most important to our communities and to the public? We almost have an independent organisation that holds us to account for delivering progress against that, and we set ourselves some really ambitious targets around it, but using the current infrastructure to accelerate that.
Right. What do you think, Sam, the future government should do?
I think a few things. I think all politicians especially the current ones, need to move away from thinking of sickness as being an individual's problem. Sickness, people do not choose to become sick. They are sick because of their life circumstances. In many people's cases, one of those life circumstances will be the degree of digital inclusivity, and the degree of digital poverty will be contributing to their sickness. So we've got to avoid this scapegoating people being sick and also chastising health service personnel, practitioners, GPs as part of that. We've got to move away from that. So future government, the first thing they need to do is change the communication between society, clinicians, and politicians around the roles of clinicians, especially GPs, and the issue of sickness, and recognise that sickness is really a symptom of one of those things being digitization. So to address it, first thing, solve digital poverty. Tackle the fact that there are some people who cannot afford devices or get online, and create an incentive scheme to give them access and eradicate digital poverty. It could easily be done. There's a small number of people in defined places. They're easily identifiable. We should be tackling that thing first. The second thing is around the degree of digital inclusivity. Set a target over a 5-year period to actually increase the degree of digital inclusivity. Create a program around improving the digital skills and literacy of the entire population, but particularly those in the most deprived communities. And then creating awareness amongst system leaders and others in business, in the environment, in schools and education around the downside of digital disengagement, digital exclusivity. What are the problems it causes? People know, and to ask about where are the others and those people who are affected.
That's great. How do we bring digital exclusion? I mean, you just expressed it well, but how do we make sure that we bring digital exclusion into future policy making around health and improving health? And I always have felt that the prevention word is another one of those words that's easy to say but difficult to do. And we know, and I'm absolutely 100% behind you, that this is not about the people who work in the NHS doing a bad job in any willful way, right? I've even gone on Twitter and extolled the virtues of the NHS in Sheffield when I hear the Today programme saying the NHS is sick. Okay, but not the people who run it, who work in it. You know, our doctors and our nurses are absolute heroes, right? We're banging pans, metaphorically now, not actually on our doorsteps. But how do we make sure that we don't just have these wonderful conversations where we all say we have to fix the digital divide and we want to decrease health inequality and increase health improvements? But how do we really make that happen in real policy terms?
So I think firstly, it's really building awareness of that connection between digital exclusion and everything else that we've just talked about. So, you know, digital exclusion doesn't just mean that we have worse personal health. It has a massive economic impact. It has a massive social impact. And so I think there is a real case for investment here, that if you tackle digital exclusion, it takes us back to our very first point in this conversation about the scale of impact that we can have. And I think it's being really clear and recognised that it's almost like a theory of change, isn't there, around this? And then I think we've got to then be able to prioritise the key actions that are going to help us make the biggest changes, because otherwise it does feel insurmountable. So we've got to make it easier. And to make it easier, you know, there's already great work going on. We have lots of evidence about where to focus efforts, you know, and so I don't think we're starting from scratch, but we just need to galvanise what is already there. And I think also then being able to demonstrate that impact, so measurement, being quite evidence-based and thoughtful about how we're showcasing the improvements it's making. But, you know, it's looking at measures and metrics that matter to communities, to the public. They're the taxpayers, they're the voters. And if we can better join that up, and I agree with Sam, taking it out of just health or healthcare, and it's everybody's business.
Yeah. It's everyone's business, yeah. And I hope actually that everyone who's listening to us in this conversation doesn't just think that was a really interesting and inspiring conversation, but actually what can I do about it? Right, so I'm now going to make you both Prime Minister, individually or together, and ask you about fixing the digital divide, because obviously that's where my passion lies, clearly for the better of all of society and the economy. So, Sam, you're the Prime Minister. What are you going to do in your first 100 days to fix the digital divide?
Run away and hide. But when I finished hiding, I think the first thing is there needs to be a Minister for Digital Inequalities. There needs to be a cross-government programme appointed with senior responsible officers and budget that spans the whole of all 4 nations, but also all government departments and areas, that focuses on solving those problems in a structured way. And the first thing being tackle digital poverty, and thereafter do some of the other things that will take slightly longer to do. And by the end of that 5-year term or period, there should be a reduction in digital inequalities. We should see economic benefit and growth, an absence of digital poverty, and a new generation of people coming through that have got less awful health outcomes because they've benefited from that investment in infrastructure that's gone in.
Fantastic. So you're the Prime Minister now. So what are you going to do to fix the digital divide in your first 100 days?
Well, first I'm going to go find Sam, who's been hiding. So I agree with everything Sam said, and just building on that, I think there are some key things that only government can do. So I think the cross-government element is absolutely key, and the fact that this is everyone's business. And if we really want the integration, the knitting together that we've just been talking about, then we've got to make sure that we're designing for that. So shared outcomes that everybody needs to deliver against. And I agree, we need somebody who is the senior responsible officer, who's key, who holds the accountability for making that happen, but then has the levers to do so. I think infrastructure is a really big issue. So, across government to be able to get better broadband access and mobile data, to be able to push across policies about having, zero data costs for the essential services. Digital becomes a utility, a basic need that everybody has the right of access to. And then, I would be listening very deeply to all of those people who are doing the brilliant work, the innovative work with their communities, and bringing them together, because they've got the ideas, they've got the solutions, but it's then understanding from them what do they need to unblock the barriers to being able to scale, accelerate, and progress that. And in return, I think it's transparency. What are we achieving? What are we learning? But creating a culture that is one of intelligent failure, because we're never going to get this right. It's always innovation fails most of the time, doesn't it? But it succeeds because you learn from all of the failures. So how are we sharing all of that learning across then the different organisations, across government, so that then we can all accelerate together?
Fantastic. Well, you both got my vote, so that's for sure. So thanks so much for coming along today and for sharing all of these ideas. I'm sure it's going to catapult us to new action. And thanks so much for joining our journey and our mission to fix the digital divide for good. Thank you both so much.
Thank
Thank you.